Hey y'all, it's your girl Suzette Viernon and welcome to my channel where I'm redefining my 60s on my own terms and hoping that by doing so, I give you permission to do the same. If this is your first time, a hearty Southern girl welcome. I encourage you to go back and listen to some previous episodes where I talk about everything that concerned me in my 60s that I needed to redefine. And in redefining it, figuring it out what my take is. You know, sometimes you realize that you've been living your life for somebody else or based on somebody else's ideas or values or beliefs, you know, what you were taught and all that. And I realized that I hadn't really taken the time to really get to know who I wanted to be post-retirement in my 60s. So I had to reevaluate everything because so much is changing. My body's changing. You know, so many different things are changing, and I needed to update in accordance with who I am at 60 and how I want my life to be in these golden years. So again, welcome, and please check out other episodes. If you like what I'm saying or it resonates with you, like, share, and subscribe. Well, I wanted to jump on. I don't have any notes or anything. It was just on my heart. I wanted to jump on, and if you see me perspiring, just please don't freak out. I don't know how many of you are dealing with what I'm dealing with, but in these spring and summer months, hot flashes and night sweats have come back with a new force and a renewed determination to irritate your girl. So you might see a little bit of perspiration with these ring lights on me, but we're going to get through it, aren't we? We're going to do our thing. I'm going to still tell you what's on my mind. What's on my mind is this, and I encourage any of you who are anticipating turning 60 or like me 65 on up, one of the things that I really encourage and I'm advocating for you to do, and that is to advocate for yourself when it comes to your health. One of the things that I'm noticing as I'm getting older is that doctors are starting to treat me differently. And I don't know if it's just an age thing or just the climate that we're in, where so much in the medical profession is under scrutiny and being reevaluated, and doctors are having to change the way they interact with their patients. They have to meet certain quotas. So there's so much pressure on physicians in the medical field. And while I empathize with that, and it's not lost on me, neither is it lost on me that I have to advocate for myself. Now, it might just be my paranoia, or it might be the very fact that I had to be that for my mother when she entered her 80s. And I started noticing that the physicians and stuff were looking at her differently. As a matter of fact, were acting like she was invisible and looking and talking to me, looking at and talking to me as if she wasn't even sitting there. And I'm already starting to see little inklings of that. If I ask for clarification, excuse me, or if I didn't hear it completely and I'm asking like, excuse me, I didn't hear that. It's like they're looking at my graying hair and looking at my age, and it feels like they're starting to not take me as seriously as they used to take me. Now, granted, one of the things that I've noticed getting older is there seems to be more issues coming up where I need to seek the advice of a physician or someone in a specialized area like gastroenterology or neurology or something like that, that I'm having to really have more conversations with my doctors about different things that seemed like when I reached 65, everything started breaking down at one time. I don't know if anybody else is dealing with that. But if it's not your head hurting, it's your foot hurting. If it's not your foot hurting, it's your stomach. If it's not your stomach, it's your blood pressure. If it's not your blood pressure, it's your AL, your A1C levels. If it's not that, it's your cholesterol levels. It's like everything, some things and everythings seem to need the feedback or the attention of your primary care doctor or someone in a specialized field. And maybe that's the reason why after a while we're not taking it seriously, because we're going to the doctor more often over this, that, and the third. But this, that, and the third is real. And I found out that the doctor is not going to take you seriously unless you take yourself seriously. If they minimize it and you agree with them, then you're doing yourself a big disservice. Case in point, I was having some issues not too long ago and I think I might have talked about it. I'm not sure. It's all a little blur right now, but I was having itching. This mysterious itching started, and I got checked out by a dermatologist. I got checked out by my primary care. I got checked out multiple times by a nurse practitioner. I went to these various doctors on several visits, conversations, messaging back and forth, trying to figure out why I was itching, right? And because the doctors couldn't figure out what was going on, every doctor was prescribing something. And sometimes those things overlapped. And I realized then, wait a minute, hold up. If I don't push back, if I don't press in more intently, if I don't advocate for myself, if I don't Google and research and equip myself to have intelligent conversations with these doctors, guess what's going to happen? They're going to say, oh, wow, it could be this, that, and the third. I don't see any organic reasons for it. And they're going to prescribe something that, for me, did not address the issue. I had 3 different prescriptions from 3 different doctors at one time, all about the same issue, and none of them addressed it. None of them. One of my doctors even prescribed Zoloft, because she said if you can't find an organic reason, then maybe it's emotional, maybe it's something happening with you with your mental health. And I was just like, I was really appalled, and I was kind of offended that an antidepressant would be prescribed because I'm itching and you haven't figured out why. Right? So it really annoyed me, but it also woke me up. And I realized, Suzette, if you don't advocate for yourself, if you don't make your issues important and press in and don't say no and keep right on, do your research, discuss things. Well, what about this? Well, could it be this? Well, can we run this test? If you don't do it and you seem sheepish because you're not sure and you don't know and you're just like, well, okay. You even have to push back about the medication and how much it costs and whether it's covered by your plan. There are a lot of things that you need to learn to advocate for yourself on. Because here's the thing. With so many of us spread out in this world, where maybe your son, your daughter, your family don't live close by, one lives in another city, one lives in another state, 9 times out of 10, you're going to have to advocate for yourself when it comes to your health. You're going to have to email the doctor, leave messages, learn the lingo from what you're reading and use it. You're going to have to learn to communicate intelligently And even if you don't know what it is, at least be able to share enough that the doctors know, oh, okay, she really is serious about this. She's researching, she's asking questions, she's not taking no for an answer. I know one doctor was telling me, well, I don't think that we need to do this test, but if you want us to do it, we'll do it. I said, yes, please do that. I said, because I need to rule out that that's not an issue. They only did it because I insisted that they do it, y'all. I insisted. And so I want to jump up here just for a little bit, not a long video or anything like that. As a matter of fact, I'm trying to kind of keep my neck more neutral, because when I talk about things that I'm passionate about, I automatically tighten my neck and my shoulders. And I've been really trying, with the help of my physical therapist and my personal trainer, to keep my neck and shoulders neutral and only use what I'm using. So I'm going to talk to you about this and try not to tense my neck up so I don't have neck pain after I get through with this video, because I'm using muscles that I don't really need to use, and let my head move freely. Okay, yes. Okay, so, but my point is, please advocate for yourself. Please, I don't care if it's a good doctor or doctor that you've been seeing for a long time. I noticed a change in my doctor when I got on Medicaid. I noticed a change in how she talked to me. Things that she might would have said 2 years before were an issue for her. This time she was saying, oh, it's not even an issue. Not an issue. And I'm thinking, well, it's not an issue for you, but it's an issue for me. And that's why I say you have to truly, truly advocate for yourself. If you've gone through some things where you've had to advocate for yourself, I want you to drop it in the comments and let's talk about it. Because especially as women, and we're getting up in age, we need to stay mentally sharp and we need to stay mentally abreast of what's going on, so that we can advocate for ourselves, communicate with our doctors well, and have intelligent conversations. And yes, press the issue when it's needed. Okay? Thanks for listening. And until next time, have a great day. And I look forward to hearing more from you. Okay? Take care. Bye-bye.